Hello, welcome to today's Enlighten Ourselves on health issues, especially those that concern us as Zambians, especially those that are happening in Zambia. So today we just want to talk about organ transplantation in Zambia. Where are we? Okay, where are we? But before we go there, let's just learn where the world was before. Okay, so according to the world history, the first skin transplant was done in 1870. Okay, in 1870. Then the first kidney transplant was done in 1939. This failed, it didn't work. So in 1953 they did another transplant. Okay, kidney transplant. Then the liver, the heart and the pancreas were done around 1960s. Okay, then the lung and the intestines were done by 1980s. Okay, so that's when now the world tried to do these things. When you talk of today, they are doing quite well in these areas, these developed countries. All right, so now let's talk about the issues that are involved in organ transplantation. So most of these are ethical issues. The issues that involve society, the issues that involve people as they are. Now, the first one is the donor ethical issues. So the donor is the person who is actually giving. Who should give? Is it the first degree relative, your sister, your cousin? Is someone who is about to die? Okay, is it no? Should people come and sell these organs? Should they give for free? Those are issues that people keep discussing. Okay, the recipient is the person who is receiving. Okay, who should receive? What will actually determine who a recipient is for a particular organ allocation. Okay, so here it's when now people they have this organ, now they are deciding, maybe they have two or more people who need it, who should actually get it, what will qualify that person to actually get it. Procurement, how do we have access to organs? Should we put an incentive? Should we tell people to sell organs? Should we tell people you are going to actually uh, pay? It's not very much advisable to actually tell people to sell their organs. Okay, I would rather personally have people just give because they want to. Okay, what's the Zambian story? The Zambian story is actually very interesting, except that we are not good at keeping records. So you'll find that some people probably have done things, but they're not recorded anywhere. We don't publish, we don't write, we don't keep records. Okay, so the first organ transplant was the skin. Okay, now because of lack of information, we don't know who first did it, we don't know where it was done. It was probably UTH, we don't know really who did it, when and where. But skin graft or transplant has been happening, and mostly it's auto skin graft where they get from the same person, they put on the other part of the same person. Okay, the first kidney transplant was done in October 2018. Okay, this is one which I think got a lot of publication, maybe because of internet now things are able to be written and stored. Okay, the heart, liver, lungs, intestines, okay, they're in progress. Okay, the good thing is that we have the guts to do something, we want to do something, and we're trying to do something. That's the only way we move forward. Okay, how does the Zambian future look in terms of organ transplantation? Okay, for me, if you ask me, it looks great because we are trying. Okay, we are trying. There's a lot of improvement in infrastructure. There's a lot of improvement in the health care workers who are actually graduating, and some are going out to do the postgraduates in different fields. We need to invest more. Okay, that cannot be overemphasized. We need to invest more. We need more people to actually go and specialize. That's one way we can have people do things. Okay, we need to overcome the social factors and cultural factors, because people believe that to get better they have to take a medication. Okay, any other alternative does not look good to them, because we're used to go to witch doctors, we are used to go to hospitals and get prescriptions. But we need to increase the knowledge and tell them that actually it's not all the diseases that needs drugs. Some we just need to change that organ. Now, after listening to this and you know, after watching the video this far, can you donate an organ to save someone? Okay, it sounds tough, right? But can you have someone donate an organ for you to save you? Okay, these are some of the questions that actually should run in our mind, even as we prepare for a future in which we can actually see doctors doing transplants. Okay. All right. We come to the end of the lecture. If you like the lecture, if you want, more insightful lecture on different topics, very short, straight to the point, you can subscribe and hit the notification button so that when we upload a video on different issues in health, we'll probably talk about different things that are common. And also, if you are interested in us, you can inbox us on Facebook, Med Center Free Medical Advice. Just inbox us, we'll get back to you. We'll surely get back to you. Have a good day and kudos. God bless.